Hello everyone, this is Nurse Anna from nursestudy.net. Today we are testing on medical surgical nursing questions with answers and rationales. Let's begin. And don't forget we have study guides and free audiobooks available in our store. The links are in the description below. Question 1. A 58-year-old client is 2 days post-operative after an open cholecystectomy. The client suddenly reports sharp chest pain that worsens with inspiration, shortness of breath, and anxiety. Vital signs: temperature 98.8, heart rate 124, respiratory rate 30, blood pressure 92/58, SpO2 86% on 2 liters nasal cannula. Which action should the nurse take first? A. Increase oxygen to 6 liters via nasal cannula. B. Place the client in high Fowler position and apply a non-rebreather mask. C. Call respiratory therapy to obtain an arterial blood gas. D. Prepare the client for emergent intubation. Correct answer: B. Rationale. B. This improves oxygenation and ventilation quickly and is a rapid independent nursing action to support airway and breathing. A. Increasing flow on nasal cannula may not correct severe hypoxia as effectively as a non-rebreather mask. C. ABGs are helpful but do not immediately improve oxygenation, so this is not the first action. D. Intubation may be needed but is not the nurse's first action before attempting non-invasive oxygen support. Question 2. A 46-year-old client with acute pancreatitis has severe epigastric pain, abdominal distension, and intractable vomiting. Vital signs: temperature 99.1, heart rate 118, respiratory rate 24, blood pressure 88/54, SpO2 95% on room air. Urine output is 15 milliliters for the past hour via Foley catheter. Which prescription should the nurse anticipate and be prepared to implement first? A. Large volume IV isotonic fluid bolus. B. IV morphine for severe pain. C. NG tube insertion to low intermittent suction. D. IV ondansetron for nausea. Correct answer: A. Rationale. A. Hypotension and oliguria indicate hypovolemia and possible shock, so restoring circulating volume is the priority to maintain organ perfusion. B. Pain management is important but comes after stabilizing circulation. C. NG decompression helps with vomiting and distension but is not more important than low blood pressure and low urine output. D. Antiemetics improve comfort but do not correct life-threatening hypovolemia. Question 3. A 72-year-old client with a history of systolic heart failure is admitted with worsening dyspnea and bilateral crackles to mid-lung fields. Vital signs: temperature 98.4, heart rate 110, respiratory rate 28, blood pressure 150/92, SpO2 90% on 2 liters nasal cannula. The healthcare provider prescribes IV furosemide. Which assessment finding would be most important for the nurse to report before administering the medication? A. Potassium 3.1 milliequivalents per liter. B. Presence of 2+ pitting edema in ankles. C. Weight gain of 2 kilograms in 3 days. D. Urine output 40 milliliters per hour. Correct answer: A. Rationale. A. Low potassium increases the risk for dangerous dysrhythmias when giving loop diuretics, so this must be reported before administration. B. Edema supports the need for diuresis but does not delay therapy. C. Recent weight gain indicates fluid overload and supports the prescription. D. Urine output is adequate and does not require holding the medication. Question 4. A 64-year-old client with a history of cirrhosis is admitted with hematemesis and melena. Vital signs: temperature 98.2, heart rate 122, respiratory rate 22, blood pressure 86/50. The client is receiving a rapid infusion of packed red blood cells. Which assessment finding requires the nurse's immediate intervention? A. New fine crackles at the lung bases. B. Dark, tarry stool in the bedpan. C. Blood pressure increased to 98/60 after 15 minutes. D. Urine output 25 milliliters for the last hour. Correct answer. A. Rationale. A. New crackles during a rapid transfusion suggest fluid overload or transfusion-related complication and require slowing or stopping the transfusion and notifying the provider. B. Melena is expected with an upper GI bleed and not an urgent new change. C. A modest improvement in blood pressure is a positive response to transfusion. D. Slightly low urine output needs monitoring but is less urgent than respiratory compromise. Question 5. A 23-year-old client with type 1 diabetes is admitted with diabetic ketoacidosis, DKA. The client has Kussmaul respirations, fruity breath odor, and dry mucous membranes. Laboratory results: glucose 520 milligrams per deciliter, pH 7.12, potassium 5.4 milliequivalents per liter, sodium 130 milliequivalents per liter. IV regular insulin and normal saline are started. Which complications should the nurse monitor for most closely in the first few hours of treatment? A. Worsening hyperkalemia causing peaked T waves. B. Rapid drop in potassium leading to dysrhythmias. C. Pulmonary embolism due to dehydration. D. Acute kidney injury from hyperglycemia. Correct answer. B. Rationale. B. Insulin drives potassium into cells, which can quickly lower serum potassium and cause dangerous dysrhythmias, so close cardiac and lab monitoring is essential. A. Potassium is high initially, but usually decreases once insulin and fluids are given. C. Dehydration increases clot risk, but this is less immediate than rapid potassium shifts. D. Kidneys are at risk, but acute life-threatening changes from potassium come first. Question 6. A 48-year-old client is 6 hours post-operative after a total thyroidectomy. The client reports increasing neck tightness and difficulty swallowing. The nurse notes hoarseness, inspiratory stridor, and slight swelling at the incision site. Vital signs: temperature 98.7, heart rate 118, respiratory rate 28, blood pressure 142/88, SpO2 91% on 2 liters, nasal cannula. Which action is the nurse's priority? A. Elevate the head of the bed and reassure the client. B. Use a tongue depressor to inspect the throat for bleeding. C. Notify the rapid response team and prepare for airway support. D. Apply ice packs to the surgical site. Correct answer. C. Rationale. C. Stridor and neck tightness suggest airway obstruction from swelling or hematoma and require immediate team response and preparation for advanced airway support. A. Upright positioning helps, but stridor is an emergency needing more than positioning. B. Using a tongue depressor may worsen airway obstruction and cause distress. D. Ice packs may reduce swelling but are not the first priority in an airway emergency. Question 7. A 69-year-old client with sudden onset right-sided weakness and slurred speech arrived to the emergency department 45 minutes ago. CT scan shows no hemorrhage. The healthcare provider is evaluating the client for possible thrombolytic therapy. Current vital signs: temperature 98.6, heart rate 88, respiratory rate 18, blood pressure 186/104, SpO2 97% on room air. Which nursing action is most important at this time? A. Lower the head of bed to improve cerebral perfusion. B. Prepare to administer antihypertensive medication as prescribed. C. Encourage the client to perform active range of motion exercises. D. Provide the client with clear liquids to prevent dehydration. Correct answer B. Rationale. B. Blood pressure is elevated and may need controlled reduction according to protocol before thrombolytic therapy, so preparing to safely administer ordered antihypertensive medications is a priority. A. Lowering the head of the bed may increase intracranial pressure. Usually the head is elevated. C. Early mobility is not priority during acute stroke evaluation. D. Oral intake is not safe until swallowing is evaluated due to aspiration risk. Question 8. A 60-year-old client with pneumonia is suspected of having sepsis. Current data: temperature 102.4, heart rate 128, respiratory rate 26, blood pressure 84/48, SpO2 93% on 3 liters nasal cannula. Urine output has dropped from 45 milliliters per hour to 10 milliliters per hour over the last 2 hours. Which assessment finding indicates that the initial fluid resuscitation has been effective? A. Heart rate decreases to 110 and urine output increases to 35 milliliters per hour. B. Temperature decreases to 99.8 and heart rate increases to 132. C. SpO2 increases to 98% on 3 liters nasal cannula. D. Blood pressure increases to 96/50 while urine output remains 10 milliliters per hour. Correct answer: A. Rationale. A. Improved urine output and a lower heart rate show better organ perfusion and improved circulation. B. Reduced temperature with increasing heart rate suggests ongoing poor perfusion. C. Better oxygen saturation alone does not prove that perfusion to organs has improved. D. Slightly higher blood pressure without improved urine output still indicates poor kidney perfusion. Question 9. A 70-year-old client with stage 4 chronic kidney disease and peripheral neuropathy is admitted with confusion and nausea. Laboratory results: BUN 80, creatinine 6.0, potassium 5.8, hemoglobin 9. Current medications include oral morphine, magnesium hydroxide, and lisinopril. Which medication should the nurse question and clarify with the healthcare provider before administering? A. Oral morphine. B. Magnesium hydroxide. C. Lisinopril. D. All medications should be given as ordered. Correct answer: B. Rationale. B. Magnesium-containing medications can build up in severe kidney disease and cause toxicity, so the nurse should clarify this medication. A. Morphine dosing may need adjustment but is not clearly unsafe from the data provided. C. Lisinopril can help control blood pressure and slow kidney damage, though potassium must be monitored closely. It is not automatically held without provider input. D. It is not safe to give all medications without questioning the magnesium product. Question 10. A 68-year-old client with severe chronic obstructive pulmonary disease, COPD, is admitted with an acute exacerbation. The client is using accessory muscles to breathe and has prolonged expirations. Current vital signs: temperature 98.1, heart rate 104, respiratory rate 30, blood pressure 138/82, oxygen saturation 84% on 2 liters nasal cannula. ABG results: pH 7.32, PaC O260 millimeters of mercury, HC O330 milliequivalents per liter. Which nursing action is most appropriate? A. Increase oxygen to maintain SpO2 between 88 and 92% as prescribed. B. Discontinue oxygen to avoid further CO2 retention. C. Encourage the client to lie flat to conserve energy. D. Prepare the client for immediate endotracheal intubation. Correct answer: A. Rationale. A. Controlled oxygen titration to a modest target range improves oxygenation while limiting the risk of worsening CO2 retention in COPD. B. Stopping oxygen is unsafe because the client is already significantly hypoxic. C. Lying flat worsens ventilation. The client should be in an upright position. D. The client is in distress but still protecting the airway and compensating. Intubation is not yet clearly required. Question 11. A 32-year-old client with a spontaneous pneumothorax has a chest tube connected to a closed drainage system with suction. The nurse notes continuous bubbling in the water seal chamber, drainage of 10 milliliters serosanguinous fluid in the last hour, SpO2 96% on 2 liters nasal cannula, and no subcutaneous emphysema. Which action is most appropriate? A. Clamp the chest tube to stop the bubbling. B. Increase the suction to eliminate bubbling. C. Continue to monitor the system in the client. D. Strip the chest tube to improve drainage. Correct answer. C. Rationale. C. Gentle continuous bubbling in the water. Seal with the pneumothorax can be expected due to ongoing air removal. Vital signs and assessment are stable, so continued monitoring is appropriate. A. Clamping can cause tension pneumothorax and is contraindicated unless specifically ordered for a brief controlled reason. B. Increasing suction does not correct normal bubbling and can damage lung tissue. D. Stripping the tube can create high negative pressure and is not recommended. Question 12. A 59-year-old client with a history of peptic ulcer disease presents with dizziness and coffee ground emesis. Vital signs: temperature 97.9, heart rate 118, respiratory rate 22, blood pressure 90/52. The healthcare provider prescribes type and cross-match CBC, basic metabolic panel, and coagulation studies. Which lab result is most urgent for the nurse to review to guide initial interventions? A. Platelet count. B. Hemoglobin and hematocrit. C. Serum creatinine. D. Serum sodium. Correct answer, B. Rationale. B. Hemoglobin and hematocrit show the severity of blood loss and help determine the need for blood transfusion and other urgent interventions. A. Platelets matter for bleeding risk but do not directly show current volume loss. C. Creatinine is important but not as urgent as assessing acute blood loss in this situation. D. Sodium can change with volume shifts but is less critical for immediate management of active bleeding. Question 13. A 68-year-old client with long-standing hypertension and heart failure suddenly develops severe dyspnea, pink frothy sputum, and audible crackles throughout both lungs. Vital signs: temperature 98.3, heart rate 132, respiratory rate 32, blood pressure 182/98, SpO2 86% on 4 liters nasal cannula. The nurse receives the following prescriptions. Which should the nurse be prepared to administer first? AIV furosemide. B. Oral lisinopril. C. Subcutaneous heparin. D. Oral metoprolol. Correct answer. A. Rationale. A. IV furosemide reduces preload and pulmonary congestion quickly, which is critical in acute pulmonary edema. B. Oral ACE inhibitors act more slowly and are not first line for this emergency. C. Heparin prevents clots but does not treat acute fluid overload and respiratory distress. D. Oral beta blockers act slowly and can worsen acute decompensation if given at the wrong time. Question 14. A 54-year-old client is post-operative day 3 after an open bowel resection. The client reports sudden severe abdominal pain and a popping sensation at the incision. On inspection, the nurse notes separation of the incision with loops of bowel visible. Vital signs: temperature 99.4, heart rate 112, respiratory rate 24, blood pressure 110/70. Which action should the nurse take first? A. Apply firm pressure directly over the exposed bowel. B. Cover the area with sterile, normal saline moistened gauze. C. Attempt to push the bowel back into the abdominal cavity. D. Place the client in high Fowler position with legs dangling. Correct answer, B. Rationale. B. This is evisceration. The priority is to protect the organs from drying and infection by covering with sterile, moist dressings and then notifying the provider. A. Firm pressure could damage the exposed bowel. C. Forcing bowel back inside can cause injury and contamination. D. High Fowler increases tension on the abdomen. The client should be kept supine with knees slightly bent. Question 15. A 40-year-old client with acute kidney injury has muscle weakness and paresthesias. Telemetry shows tall peaked T waves. Laboratory results: potassium 6.7 milliequivalents per liter, creatinine 4.8 milligrams per deciliter, BUN 70 milligrams per deciliter. Which prescription should the nurse implement first to protect the client from life-threatening complications? A. Administer oral sodium polystyrene sulfonate. B. Prepare to administer IV regular insulin with dextrose. C. Restrict dietary potassium intake. D. Prepare the client for hemodialysis tomorrow. Correct answer. B. Rationale. B. IV. Insulin with dextrose quickly shifts potassium into cells and is a rapid priority treatment for dangerous hyperkalemia with ECG changes. A. Sodium polystyrene acts slowly and is not adequate alone for immediate ECG changes. C. Diet changes help long-term but do not rapidly lower a potassium of 6.7. D. Hemodialysis may be needed, but preparation for tomorrow does not address the immediate risk. Question 16. A 63-year-old client is admitted with an acute ST elevation, myocardial infarction, and is receiving IV nitroglycerin. New prescriptions include IV morphine, aspirin, and IV metoprolol. Which assessment finding would make the nurse question administering the IV metoprolol? A. Heart rate 58, blood pressure 98/60, pain 4 of 10. B. Heart rate 110, blood pressure 148/90, pain 8 of 10. C. Heart rate 76, blood pressure 122/80, pain 6 of 10. D. Heart rate 88, blood pressure 100/64, pain 3 of 10. Correct answer. A. Rationale. A. Beta blockers can further lower heart rate and blood pressure. A heart rate below 60 and borderline blood pressure warrant clarification before administration. B. Elevated heart rate and blood pressure support the use of a beta blocker. C. Vital signs are stable and appropriate for metoprolol. D. Vitals are acceptable. There is no clear reason to hold the medication. Question 17. A client receiving peritoneal dialysis at home presents to the clinic with complaints of abdominal pain and cloudy effluent in the drainage bag. Vital signs: temperature 101.5, heart rate 104, respiratory rate 20, blood pressure 118/72. Which nursing action is the priority? A. Document findings and continue routine dialysis. B. Warm the dialysate solution before the next exchange. C. Notify the healthcare provider about suspected peritonitis. D. Encourage the client to increase oral fluid intake. Correct answer. C. Rationale. C. Cloudy effluent and abdominal pain with fever suggest peritonitis, a serious complication that requires prompt provider notification and likely antibiotic therapy. A. Continuing without intervention can worsen infection. B. Warming dialysate can reduce cramping but does not treat infection. D. Fluids do not address the underlying infection risk. Question 18. A 72-year-old client is post-operative day 1 following a left total hip arthroplasty with a posterior approach. Which positioning instruction should the nurse give to the unlicensed assistive personnel to reduce the risk of dislocation? A. Place a pillow under the left knee to keep the hip flexed. B. Assist the client to cross legs at the ankles when turning. C. Keep an abduction pillow between the client's legs while in bed. D. Turn the client to the affected side with the legs adducted. Correct answer. C. Rationale. C. An abduction pillow keeps the legs apart and prevents hip adduction and internal rotation, which helps prevent dislocation after hip replacement. A. Hip flexion beyond recommended limits increases dislocation risk. B. Leg crossing causes adduction and can lead to dislocation. D. Turning to the affected side with legs together can stress the new joint. Question 19. A 28-year-old client with a history of severe asthma is admitted with status asthmaticus. The client has been receiving repeated nebulized short-acting beta agonists. Current assessment: respiratory rate 34, heart rate 128, blood pressure 132/78, SpO2 89% on 4 liters nasal cannula, inspiratory and expiratory wheezing with diminished air movement, use of accessory muscles. Which finding would indicate that the client is deteriorating and needs immediate provider notification? A. Wheezing that becomes louder after the last treatment. B. Heart rate decreases to 110 after treatment. C. Breath sounds suddenly become very quiet with minimal wheezing. D. O2 sat increases to 93% on 4-liter nasal cannula. Correct answer. C. Rationale. C. Very quiet breath sounds with little wheezing can mean very poor airflow and impending respiratory failure, which is an emergency. A. Louder wheezing can actually mean air is moving better. B. Slight decrease in heart rate is expected as distress improves. D. Improved oxygen saturation is a positive sign, not deterioration. Question 20. A 58-year-old client with advanced cirrhosis is admitted with increasing abdominal distension and easy bruising. Vital signs: temperature 98.4, heart rate 96, respiratory rate 18, blood pressure 110/68. Laboratory results: platelets 72,000 per cubic millimeter, INR 2.4, hemoglobin 11 grams per deciliter, ammonia mildly elevated. Which nursing intervention is most important to reduce the client's risk of serious bleeding? A. Encourage firm toothbrushing to maintain oral hygiene. B. Avoid intramuscular injections whenever possible. C. Encourage the client to perform active range of motion exercises. D. Increase intake of high-protein foods. Correct answer. B. Rationale. B. Low platelets and elevated IR greatly increase bleeding risk. Avoiding intramuscular injections helps prevent hematomas and uncontrolled bleeding. A. Firm brushing can cause gum bleeding. A soft toothbrush is preferred. C. Range of motion is helpful but not the primary bleeding prevention intervention. D. Protein is important in liver disease but does not immediately reduce bleeding risk. Question 21. A 71-year-old client arrives to the emergency department with sudden right-sided weakness and facial droop that began 45 minutes ago. The CT scan shows no bleeding. Current vital signs: temperature 98.7, heart rate 96, respiratory rate 20, blood pressure 176/96. Which assessment finding would make the nurse question potential administration of IV alteplase TPA? A. Current use of warfarin with INR 2.6. B. History of hypertension controlled with medication. C. Facial droop and slurred speech. D. Blood glucose 140 milligrams per deciliter. Correct answer. A. Rationale. A. An elevated INR from warfarin increases the risk of serious bleeding with alteplase and is a major concern before giving this medication. B. Controlled hypertension alone is not a reason to avoid alteplase, though blood pressure is managed within protocol limits. C. These are typical stroke symptoms and support, not prevent alteplase use. D. Mildly elevated glucose is common in acute stroke and is not a direct contraindication. Question 22. A 63-year-old client with a high small bowel obstruction has a nasogastric NG tube connected to low intermittent suction. The client reports ongoing nausea and increasing abdominal distension. The nurse notes minimal NG output in the last 2 hours, high-pitched bowel sounds, and that the external NG tubing appears kink near the nose. Which action should the nurse take first? A. Flush the NG tube with 60 milliliters tap water. B. Reposition the client and straighten the NG tubing. C. Increase the suction level to high continuous. D. Remove the NG tube and notify the provider. Correct answer. B. Rationale. B. Repositioning and correcting kinks can restore NG function and relieve symptoms while staying within the nurse's scope and safety guidelines. A. Flushing may be done per policy but is not first if a visible kink is present. C. High continuous suction can damage the gastric mucosa and is not appropriate without an order. D. Removing the NG tube is not indicated when simple mechanical correction may fix the problem. Question 23. A 21-year-old client presents with right lower quadrant abdominal pain, low-grade fever, nausea, and loss of appetite. The client reports that the pain suddenly decreased from 8 of 10 to 2 of 10. The nurse notes abdominal rigidity and rebound tenderness with vital signs: temperature 101.3, heart rate 118, respiratory rate 24, blood pressure 100/64. Which action is the nurse's priority? A. Apply a heating pad to the abdomen for comfort. B. Administer prescribed IV morphine for pain relief. C. Notify the healthcare provider about possible perforation. D. Encourage the client to ambulate to relieve gas. Correct answer, C. Rationale. C. Sudden pain relief with rigidity and fever suggests possible appendix rupture and peritonitis, which is an emergency requiring immediate provider notification. A. Heat can increase inflammation and is contraindicated in suspected appendicitis or rupture. B. Pain should be treated, but the potential life-threatening complication must be reported first. D. Ambulation may increase pain and risk of further peritoneal irritation. Question 24. A 55-year-old client with small cell lung cancer is admitted with serum sodium 118 milliequivalents per liter. The client is receiving IV normal saline. Current assessment: headache, confusion, muscle cramps, and decreased deep tendon reflexes. Vital signs: temperature 98.4, heart rate 102, respiratory rate 18, blood pressure 130/78. Which nursing intervention is most important to include in the plan of care? A. Encourage intake of free water to maintain hydration. B. Implement seizure precautions and close neurologic monitoring. C. Encourage the client to ambulate frequently in the hall. D. Place the client in a high stimulus environment to maintain orientation. Correct answer. B. Rationale. B. Severe hyponatremia can cause cerebral edema and seizures, so seizure precautions and frequent neurologic checks are critical. A. Free water worsens hyponatremia by further diluting serum sodium. C. Ambulation is secondary to safety concerns and neurologic instability. D. A high stimulus environment can worsen confusion and agitation. Question 25. A 67-year-old client with osteoarthritis and coronary artery disease is admitted with a large upper GI bleed. The client has been taking high-dose ibuprofen and low-dose aspirin at home. New prescriptions include IV pantoprazole, packed red blood cells, and continued low-dose aspirin. Which action is most appropriate for the nurse? A. Question the continuation of low-dose aspirin and clarify with the provider. B. Hold the IV pantoprazole until after the first unit of blood is transfused. C. Recommend switching ibuprofen to an over-the-counter herbal supplement. D. Suggest adding an oral NSAID for better pain control. Correct answer. A. Rationale. A. Aspirin further impairs platelet function and may worsen active GI bleeding, so continuing it should be questioned and clarified. B. IV proton pump inhibitors are important early in GI bleeding and should not be delayed. C. Herbal supplements may also increase bleeding risk and must be evaluated carefully, not automatically recommended. D. Additional NSAIDs would further irritate the GI tract and worsen bleeding. Question 26. A 62-year-old client with severe pneumonia is on a mechanical ventilator with continuous sedation. The nurse notes heart rate 118, respiratory rate set at 18 with observed asynchronous breathing, blood pressure 88/52, SpO2 90% on 60% FiO2, and a Richmond Agitation Sedation Scale, RASS, of -1, a light sedation. Which action should the nurse take first? A. Increase the sedation infusion to achieve deeper sedation. B. Assess lung sounds, ventilator settings, and check for tube displacement. C. Place the client in a flat position to improve blood pressure. D. Reduce FiO2 to 40% to avoid oxygen toxicity. Correct answer, B. Rationale. B. Asynchronous breathing and borderline oxygenation require assessment of ventilator function, lung status, and tube position before changing sedation or oxygen. A. Increasing sedation without assessing the cause may worsen hypotension and hide important clinical signs. C. Lying flat can compromise ventilation in a respiratory failure patient. D. Reducing FiO2 is not safe when oxygen saturation is already low. Question 27. A 59-year-old client with poorly controlled type 2 diabetes has a plantar foot ulcer with surrounding erythema and mild drainage. The client's A1C is 10.2%. Vital signs: temperature 99.6, heart rate 90, respiratory rate 16, blood pressure 134/82. Which nursing instruction is most important to help prevent further complications? A. Soak the foot in hot water 3 times daily. B. Walk barefoot at home to promote air exposure. C. Inspect the feet daily using a mirror for areas that are hard to see. D. Trim toenails very short to avoid ingrown nails. Correct answer, C. Rationale. C. Daily inspection helps detect new injuries or infection early in a client with neuropathy and poor glucose control. A. Hot water can cause burns in clients with decreased sensation. B. Walking barefoot increases the risk for trauma and infection. D. Cutting nails very short can cause skin injury and infection. Question 28. A 50-year-old client is 8 hours post-operative after a craniotomy for tumor removal. Current findings: headache rated 6 of 10, slight nausea, and a small amount of serosanguinous drainage on the head dressing. Vital signs: temperature 99.0, heart rate 88, respiratory rate 16, blood pressure 138/84. Which new assessment finding would require the nurse's immediate action? A. Blood pressure 150/90 with heart rate 90. B. Slightly increased headache relieved by prescribed analgesic. C. New onset of unequal pupils and decreased level of consciousness. D. Nausea improving after antiemetic administration. Correct answer, C. Rationale. C. Unequal pupils and decreased consciousness suggest increased intracranial pressure or brain herniation and require urgent intervention. A. Mildly elevated blood pressure is common postoperatively and not as urgent alone. B. Pain that improves with treatment is expected. D. Improving nausea is a positive sign, not an emergency. Question 29. A client receiving TPN via a central line develops increased thirst, frequent urination, and new onset confusion. Vital signs: temperature 98.9, heart rate 112, respiratory rate 20, blood pressure 124/76. Capillary blood glucose is 420 milligrams per deciliter. Which action is most appropriate for the nurse to take? A. Stop the TPN immediately and flush with 10 milliliters normal saline. B. Slow the TPN rate and notify the healthcare provider of hyperglycemia. C. Switch from TPN to 0.45% normal saline. D. Increase the TPN rate for better nutrition support. Correct answer. B. Rationale. B. Hyperglycemia is a known TPN complication. Slowing the infusion as per protocol and notifying the provider for insulin adjustment is appropriate. A. Abruptly stopping TPN can cause hypoglycemia and is not done without specific order. C. Changing fluids and concentration is a provider decision, not independent nursing action. D. Increasing the rate would worsen hyperglycemia. Question 30. A 64-year-old post-hip fracture client has a newly diagnosed DVT in the left calf confirmed by ultrasound and is receiving IV heparin. Which instruction should the nurse give to the unlicensed assistive personnel? A. Massage the client's left leg to improve circulation. B. Assist the client to ambulate frequently to prevent clot extension. C. Use a soft tape measure to check both calves for changes in size. D. Apply sequential compression devices to both legs. Correct answer. C. Rationale. C. Measuring calf circumference helps monitor for changes in swelling and is a safe task to delegate with clear instructions. A. Massaging the leg can dislodge the clot and cause an embolus. B. Ambulation is done cautiously after provider clearance. Frequent unsupervised ambulation is unsafe early on. D. Sequential compression devices are contraindicated on an extremity with an active DVT. Question 31. A 35-year-old client is admitted after a motor vehicle collision with suspected intra-abdominal bleeding. Current findings: cool, clammy skin, anxiety, heart rate 136, respiratory rate 28, blood pressure 78/46, SpO2 95% on 2 liters nasal cannula, flat neck veins, and urine output 10 milliliters in the last hour. Which intervention should the nurse anticipate and prepare to implement first? A. Administer IV morphine for severe pain. B. Prepare for rapid infusion of isotonic crystalloid solution. C. Place the client in a high Fowler position. D. Obtain a urine sample for urinalysis. Correct answer. B. Rationale. B. The client is in hemorrhagic shock with signs of poor perfusion, so rapid volume resuscitation with isotonic fluids is the highest priority to support circulation. A. Pain control is important but secondary to stabilizing blood pressure and perfusion. C. High Fowler can decrease venous return and worsen hypotension. D. Urinalysis is not a priority when the client is hemodynamically unstable. Question 32. A 52-year-old client with sepsis is receiving IV vancomycin and has developed acute kidney injury. Current labs: BUN 65 milligrams per deciliter, creatinine 3.8 milligrams per deciliter, urine output 0.3 milliliters per kilogram per hour over 6 hours. The client is scheduled to receive the next dose of IV vancomycin. Which nursing action is most appropriate? A. Administer the vancomycin as scheduled and document. B. Hold the vancomycin dose and notify the healthcare provider of renal function trends. C. Increase the IV rate of vancomycin to shorten infusion time. D. Flush the IV line with heparin before administering vancomycin. Correct answer. B. Rationale. B. Worsening renal function increases the risk of vancomycin toxicity, so the nurse should hold the dose and report lab trends to the provider for possible dose adjustment. A. Giving the drug without clarification may worsen kidney damage. C. Faster infusion increases risk of adverse reactions. D. Heparin flush is not standard for peripheral lines and does not address nephrotoxicity. Question 33. A 44-year-old client with untreated Graves' disease is admitted with agitation, tremors, and weight loss. Vital signs: temperature 103.4, heart rate 148, Respiratory rate 24, blood pressure 152/84. The client reports palpitations and shortness of breath. Which nursing action is the priority? A. Provide a high-calorie meal with caffeine-containing beverages. B. Place the client in a quiet, cool room and administer prescribed beta blocker. C. Encourage the client to ambulate in the hall to reduce anxiety. D. Apply warm blankets and encourage increased oral fluids. Correct answer, B. Rationale. B. High fever, tachycardia, and agitation suggest possible thyroid storm. Reducing metabolic demand and heart rate with cooling measures and beta blocker is priority. A. Caffeine increases sympathetic activity and should be avoided. C. Ambulation increases metabolic demand and heart workload. D. Warming blankets worsen hyperthermia. Question 34. A 26-year-old client is post-operative day 1 after open reduction and internal fixation of a femur fracture. Suddenly, the client becomes restless and confused and reports shortness of breath. Assessment: petechiae on the chest, heart rate 124, respiratory rate 30, blood pressure 110/68, SpO2 88% on 2 liters nasal cannula. Which intervention should the nurse implement first? A. Place the client in high Fowler position and apply a non-rebreather mask. B. Encourage the client to cough and deep breathe. C. Obtain a sputum culture. D. Increase the IV maintenance fluids. Correct answer. A. Rationale. A. Symptoms suggest fat embolism. Priority is to maximize oxygenation with high-flow oxygen and upright positioning. B. This is helpful but less urgent than increasing oxygen delivery. C. Sputum culture is not a priority in an acute embolic event. D. Increasing fluids may not directly improve oxygenation and should follow provider orders. Question 35. A 49-year-old client with acute liver failure presents with jaundice, ascites, and increasing confusion. The client has asterixis, flapping tremor, and difficulty following commands. Vital signs: temperature 98.2, heart rate 100, respiratory rate 20, blood pressure 118/70. Which nursing intervention is most important to include in the plan of care? A. Restrict protein intake completely to 0 grams per day. B. Implement fall precautions and monitor neurologic status frequently. C. Encourage use of sedative medications to help with restlessness. D. Encourage high sodium foods to maintain blood pressure. Correct answer. B. Rationale. B. Confusion and asterixis indicate hepatic encephalopathy. Fall precautions and close neurologic monitoring are crucial for safety. A. Protein may be reduced but not fully eliminated. This is a provider-directed change. C. Sedatives can worsen encephalopathy and must be used cautiously. D. High sodium can worsen ascites and fluid retention. Question 36. A 30-year-old client with known ulcerative colitis is admitted with severe abdominal cramping and 12 bloody stools in the past 24 hours. The client appears pale and weak. Vital signs: temperature 100.6, heart rate 118, respiratory rate 20, blood pressure 102/64. Which provider prescription should the nurse implement first? A. Obtain a stool specimen for culture and sensitivity. B. Start IV normal saline at 150 milliliters per hour. C. Administer scheduled oral mesalamine. D. Provide teaching about long-term diet changes. Correct answer. B. Rationale. B. Frequent bloody stools and tachycardia indicate risk of hypovolemia. Fluid resuscitation is the priority to maintain perfusion. A. Stool culture is important but not more urgent than fluid replacement. C. Oral medications are secondary when the client is acutely unstable. D. Long-term teaching is postponed until the acute phase is controlled. Question 37. A 70-year-old client with chronic obstructive pulmonary disease, COPD, is admitted for pneumonia. Current findings: drowsiness, shallow respirations at 10 per minute, heart rate 88, blood pressure 130/76, SpO2 88% on 3 liters nasal cannula. The client was given a benzodiazepine for anxiety 1 hour ago. Which action should the nurse take first? A. Increase oxygen to 6 liters via nasal cannula. B. Notify the healthcare provider and prepare to administer a benzodiazepine reversal agent as ordered. C. Encourage the client to ambulate to improve lung expansion. D. Place the client in a supine position with one pillow. Correct answer, B. Rationale. B. Sedative-induced hypoventilation in a C. OPD client can rapidly worsen. Reversal and provider notification are priority to support ventilation. A. Simply increasing oxygen does not correct hypoventilation and may worsen CO2 retention. C. Ambulation is unsafe in a drowsy hypoventilating client. D. Supine position can further impair ventilation. Question 38. A 24-year-old client with sickle cell disease is admitted with a vaso-occlusive crisis, reporting severe generalized pain, rated 10 of 10, fatigue, and dark-colored urine. Vital signs: temperature 100.8, heart rate 110, respiratory rate 22, blood pressure 128/76, SpO2 93% on room air. Which nursing intervention is the priority? A. Encourage fluid intake and administer prescribed IV opioids for pain. B. Apply cold packs to painful joints. C. Restrict activity and keep the client NPO. D. Administer a diuretic to increase urine output. Correct answer, A. Rationale. A. Hydration helps reduce sickling by improving blood flow, and aggressive pain control is essential to reduce stress and oxygen demand. B. Cold causes vasoconstriction and can worsen sickling. Warm measures are preferred. C. Some activity may be allowed as tolerated. NPO status is not indicated. D. Diuretics can worsen dehydration and sickling. Question 39. A 47-year-old client is 2 days post-operative after a total colectomy with ileostomy. The nurse notes liquid green-brown output of 900 milliliters in the last 8 hours, dry mucous membranes, and lightheadedness when the client stands. Vital signs: temperature 98.3, heart rate 112, respiratory rate 20, blood pressure 96/60. Which action is most important? A. Document findings as expected and continue routine care. B. Encourage the client to drink more oral fluids only. C. Notify the healthcare provider about suspected fluid volume deficit. D. Apply an abdominal binder to prevent herniation. Correct answer, C. Rationale: C. High ileostomy output with signs of dehydration and orthostatic changes indicates fluid volume deficit requiring provider notification and likely IV fluids. A. These findings are not fully expected. They show clinically significant fluid loss. B. Oral fluids may not be enough to correct the deficit. D. An abdominal binder does not address hypovolemia. Question 40. A 19-year-old client is admitted with suspected meningococcal meningitis. Symptoms include severe headache, nuchal rigidity, photophobia, fever 102.9, heart rate 110, respiratory rate 22, blood pressure 128/72, and purpuric rash on the trunk. Which nursing action is most important to perform first? A. Place the client on droplet precautions. B. Obtain a urine sample for culture. C. Assist the client with ambulation to the bathroom. D. Provide a warm, brightly lit environment for comfort. Correct answer, A. Rationale. A. Meningococcal meningitis is highly contagious. Droplet precautions must be initiated immediately to protect other clients and staff. B. Urine culture is not the primary diagnostic test in suspected meningitis. C. Ambulation is unsafe in an acutely ill client with severe headache and photophobia. D. Bright light worsens photophobia. A dim, quiet room is better. Question 41. A 59-year-old client with long-standing hypertension reports sudden, severe tearing chest pain that radiates to the back between the shoulder blades. Vital signs: temperature 98.6, heart rate 118, respiratory rate 24, blood pressure 192/102 in the right arm and 150/88 in the left arm. The nurse notes diminished peripheral pulses in the lower extremities. Which action is the priority? A. Administer prescribed sublingual nitroglycerin for chest pain. B. Assist the client to ambulate to the bathroom with help. C. Place the client on bed rest and notify the healthcare provider immediately. D. Encourage the client to perform deep breathing exercises. Correct answer: C. Rationale: C. Findings suggest acute aortic dissection, a life-threatening emergency. The client must be kept on strict bed rest to reduce shear stress and the provider notified at once. A. Nitroglycerin may be used, but definitive management decisions must be guided by the provider urgently. B. Ambulation increases aortic wall stress and risk of rupture. D. Deep breathing does not address the underlying emergency and may distract from urgent action. Question 42. A 68-year-old client in the ICU with septic shock is receiving norepinephrine via central line. Current findings: temperature 101.8, heart rate 112, respiratory rate 22, blood pressure 104/64, MAP 77, SpO2 95% on 2 liters nasal cannula, urine output 0.6 milliliters per kilogram per hour. The nurse notes that the client's fingers and toes are cool with delayed capillary refill. Which action is most important? A. Titrate the norepinephrine to achieve MAP greater than or equal to 65 as ordered and monitor peripheral perfusion. B. Discontinue the norepinephrine because of cool extremities. C. Increase the oxygen flow to 6 liters via nasal cannula. D. Restrict oral fluids to prevent fluid overload. Correct answer: A. Rationale: A. MAP is at goal, but close monitoring and titration within ordered parameters are essential to balance organ perfusion and peripheral vasoconstriction in septic shock. B. Abruptly stopping vasopressor can cause life-threatening hypotension. C. Oxygenation is adequate. Increasing oxygen is not the priority intervention. D. Fluid restriction is not appropriate in septic shock unless ordered for specific reasons. Question 43. A 57-year-old client with a new pulmonary embolism is started on IV heparin infusion. Current labs: a PTT 110 seconds, goal 60 to 80 seconds per protocol, platelets 210,000, hemoglobin 13 grams per deciliter. The client reports mild gum bleeding when brushing teeth. Which nursing action is most appropriate? A. Stop the heparin infusion and flush the line with heparinized solution. B. Notify the healthcare provider and anticipate a decrease in the heparin infusion rate. C. Encourage the client to brush teeth more frequently to toughen gums. D. Administer an additional heparin bolus to improve clot prevention. Correct answer: B. Rationale: B. APTT is above therapeutic range with minor bleeding, so the nurse should notify the provider and anticipate rate adjustment per protocol. A. Completely stopping heparin without direction could risk clot extension. C. More brushing will worsen gum bleeding. A soft toothbrush should be used instead. D. Additional heparin bolus would greatly increase bleeding risk. Question 44. A 45-year-old client with acute pancreatitis reports increasing shortness of breath and left-sided chest pain that worsens with deep breathing. Assessment: diminished breath sounds at the left lung base. Oxygen saturation 92% on 2 liters nasal cannula. Heart rate 110. Respiratory rate 26. Blood pressure 124/80. Temperature 100.1. Which complication should the nurse suspect and report promptly? A. Left lower lobe pneumonia. B. Pleural effusion related to pancreatitis. C. Pulmonary embolism originating from the leg veins. D. Simple atelectasis from shallow breathing. Correct answer? B. Rationale. B. Acute pancreatitis can cause exudative pleural effusions, often on the left side, leading to dyspnea and diminished breath sounds that require further evaluation. A. Pneumonia is possible but classically has crackles and more focal infection signs. C. Pulmonary embolism usually presents with more sudden hypoxia and may be less directly linked to pancreatitis. D. Atelectasis causes diminished sounds, but pleural effusion is more strongly associated with pancreatitis. Question 45. A 38-year-old client with myasthenia gravis reports increasing difficulty swallowing and chewing near meal times. The client takes pyridostigmine 4 times daily. Which instructions should the nurse reinforce to improve the client's ability to eat safely? A. Take pyridostigmine immediately after meals with a full glass of water. B. Take pyridostigmine 30 to 60 minutes before meals. C. Double the dose of pyridostigmine at bedtime. D. Skip the pyridostigmine dose if not feeling weak. Correct answer: B. Rationale. B. Taking pyridostigmine before meals improves muscle strength at the time of eating, reducing the risk of aspiration and fatigue. A. Taking the medication after meals does not maximize chewing and swallowing strength. C. Doubling doses without orders is unsafe and may cause cholinergic crisis. D. Skipping doses can worsen weakness and risk of complications. Question 46. A 29-year-old client is 6 hours post-lumbar puncture performed to evaluate meningitis. The client reports severe headache that worsens when sitting or standing and improves when lying flat. Vital signs: temperature 98.8, heart rate 88, respiratory rate 16, blood pressure 118/72. Which nursing intervention is most appropriate? A. Maintain the client in a supine position and encourage oral fluids as tolerated. B. Place the client in high Fowler position to decrease intracranial pressure. C. Restrict fluids to minimize cerebrospinal fluid production. D. Encourage the client to ambulate frequently to relieve discomfort. Correct answer: A. Rationale. A. Post-dural puncture headache is relieved by lying flat in hydration, which helps with CSF replacement and comfort. B. Upright positioning usually worsens this type of headache. C. Fluid restriction may prolong symptoms. D. Ambulation may increase discomfort and is not the first-line intervention. Question 47. A 36-year-old client with acute gastroenteritis has had multiple episodes of vomiting and diarrhea for 24 hours. Labs show sodium 132 milliequivalents per liter, potassium 2.9 milliequivalents per liter, BUN 30 milligrams per deciliter, creatinine 1.3 milligrams per deciliter. Vital signs: temperature 99.0, heart rate 118, respiratory rate 20, blood pressure 96/62. Which prescribed treatment is the priority for the nurse to implement? A. Oral rehydration solution as tolerated. B. IV potassium chloride added to maintenance fluids. C. Antidiarrheal medication to stop fluid loss. D. Clear liquid diet and bed rest. Correct answer: B. Rationale. B. Significant hypokalemia with tachycardia and volume loss is dangerous. IV potassium replacement with cardiac and renal monitoring is a priority intervention. A. Oral fluids are helpful but may not correct severe deficits quickly enough. C. Antidiarrheals are often avoided in infectious diarrhea and do not correct hypokalemia. D. Diet and rest are supportive but not the most urgent therapy. Question 48. A 65-year-old client receiving unfractionated heparin for treatment of DVT has a platelet count that dropped from 240,000 to 90,000 over 3 days. The client now reports new pain and pallor in the right foot. Vital signs: temperature 98.5, heart rate 96, respiratory rate 18, blood pressure 126 over 78. Which action should the nurse take first? A. Document the findings and continue the heparin infusion. B. Stop the heparin infusion and notify the healthcare provider. C. Apply warm compresses to the right foot. D. Administer an additional heparin bolus to prevent clot extension. Correct answer: B. Rationale. B. Sudden platelet drop and new ischemic pain suggest hit with new thrombosis. Heparin must be stopped and the provider notified for alternative anticoagulation. A. Continuing heparin could worsen thrombosis and thrombocytopenia. C. Warm compresses do not treat the underlying serious reaction. D. More heparin is contraindicated and dangerous in hit thumb. Question 49. A 60-year-old client received IV alteplase 1 hour ago for an acute ischemic stroke. Current findings: improved speech, slight right-sided weakness, blood pressure 150 over 86, heart rate 84, respiratory rate 18, temperature 98.4. Which new assessment finding requires the nurse's immediate action? A. Mild headache rated 3 of 10. B. Oozing of blood from the IV insertion site. C. Sudden onset of abdominal pain and a rigid distended abdomen. D. Blood pressure increased to 160 over 90 with no other changes. Correct answer: C. Rationale. C. Rigid, painful abdomen after thrombolysis may signal internal bleeding and is an emergency requiring immediate provider notification and interventions. A. Mild headache is monitored but can be common. B. Minor oozing at IV sites is expected but monitored closely. D. Slight blood pressure change is important but less urgent than suspected internal hemorrhage. Question 50. A 40-year-old client with 35% total body surface area, partial thickness burns, is receiving lactated Ringer solution per protocol. 4 hours after injury, vital signs: temperature 97.9, heart rate 118, respiratory rate 24, blood pressure 110 over 70, urine output 20 milliliters per hour via Foley catheter. Which action is most important for the nurse? A. Continue current fluid rate and reassess in 4 hours. B. Notify the healthcare provider that urine output is inadequate and anticipate an increase in fluid rate. C. Restrict fluids to prevent pulmonary edema. D. Remove the Foley catheter to reduce infection risk. Correct answer: B. Rationale. B. In the early burn phase, urine output less than 30 to 50 milliliters per hour suggests inadequate resuscitation. Fluids typically need adjustment in collaboration with the provider. A. Waiting 4 more hours with low output risks acute kidney injury. C. Fluid restriction is unsafe during initial burn resuscitation. D. Foley is needed for accurate urine monitoring during resuscitation. Question 51. A 50-year-old client with acute pericarditis suddenly reports worsening chest pain and feels very dizzy. Assessment shows jugular venous distension, muffled heart sounds, and a drop in blood pressure from 120 over 76 to 86 over 60. Heart rate is 128, respiratory rate 26, SpO2 95% on 2 liters nasal cannula. Which action is the nurse's priority? A. Place the client in high Fowler position and administer prescribed nitroglycerin. B. Notify the healthcare provider immediately and prepare the client for possible pericardiocentesis. C. Encourage the client to take slow, deep breaths and reassess in 30 minutes. D. Obtain a 12-lead ECG and wait for results before taking further action. Correct answer, B. Rationale. B. Hypotension, JV, D, and muffled heart sounds suggest cardiac tamponade, a life-threatening complication requiring urgent provider notification in preparation for pericardiocentesis. A. Nitroglycerin is not appropriate for tamponade and can worsen hypotension. C. Delaying action puts the client at risk for cardiovascular collapse. D. ECG is useful but should not delay emergency treatment for suspected tamponade. Question 52. A 63-year-old client with osteomyelitis of the tibia is receiving long-term IV vancomycin through a peripherally inserted central catheter, PIC. The client reports ringing in the ears and mild dizziness. Vital signs: temperature 98.7, heart rate 88, respiratory rate 16, blood pressure 130/78. Which action is most appropriate for the nurse? A. Document the findings as expected side effects of therapy. B. Slow the infusion rate and continue the current dose. C. Notify the healthcare provider about possible ototoxicity. D. Flush the PIC and switch to a peripheral IV line. Correct answer, C. Rationale. C. Tinnitus and dizziness may signal vancomycin ototoxicity. The nurse must report this promptly so the provider can adjust therapy. A. These are not harmless effects and cannot be ignored. B. Slowing the infusion does not address potential permanent ear damage. D. Changing the line type does not affect ototoxic risk. Question 53. A 72-year-old client with chronic systolic heart failure is admitted with dyspnea on exertion, 3+ bilateral lower extremity edema, and orthopnea. The client asks why the diet is restricted to 2 grams of sodium per day. Which explanation by the nurse is most accurate and appropriate? A. Low sodium will prevent your blood from clotting too quickly. B. Eating less sodium helps decrease fluid retention and workload on your heart. C. Sodium restriction is mainly used to prevent constipation while you are in bed. D. Low sodium helps your heart pump faster during exercise. Correct answer, B. Rationale. B. Sodium causes the body to hold on to water. Lowering sodium helps decrease fluid overload and reduces stress on a weakened heart. A. Sodium intake is not focused on clotting time. C. Sodium restriction does not prevent constipation. D. The goal is to reduce fluid volume, not speed up the heart. Question 54. A 29-year-old client with a severe exacerbation of Crohn's disease has been placed NPO with an order for total parenteral nutrition, TPN. The client is upset and asks why eating is not allowed. Which response by the nurse is best? A. The TPN is stronger nutrition than any food you could eat. B. Avoiding food by mouth helps decrease bowel inflammation and allows your intestines to rest. C. You are NPO so that you will be ready for surgery at any time. D. Eating food right now could cause your bowels to twist. Correct answer, B. Rationale. B. Bowel rest during severe flares reduces stimulation of the inflamed intestine and promotes healing. A. TPN is not stronger but is used to provide nutrition when the gut needs rest. C. Surgery may or may not be needed. NPO is primarily to rest the bowel. D. Crohn's disease is not primarily about bowel twisting. Question 55. A 58-year-old client arrives with a blood pressure of 220/120, severe headache, blurry vision, and confusion. The client has a history of untreated hypertension. The provider prescribes IV antihypertensive medication. What is the nurse's priority goal when administering this medication? A. Reduce blood pressure to normal within 30 minutes. B. Lower blood pressure gradually to prevent decreased cerebral perfusion. C. Maintain blood pressure at or above 200/110 to avoid reflex tachycardia. D. Lower blood pressure only when the client is pain-free. Correct answer, B. Rationale, B. In a hypertensive emergency, blood pressure must be lowered carefully to avoid ischemia to the brain, heart, and kidneys. A. Rapid normalization can cause stroke or organ ischemia. C. Keeping blood pressure extremely high maintains the emergency state and does not protect the client. D. Pain management is important but not the main guide for blood pressure treatment. Question 56. A 40-year-old client with a known 6 mm ureteral kidney stone presents with sudden severe flank pain radiating to the groin, nausea, and hematuria. Vital signs: temperature 99.0, heart rate 112, respiratory rate 20, blood pressure 140/88. The client has not voided in 6 hours and reports strong urgency with minimal dribbling of urine. Which action is the nurse's priority? A. Encourage increased oral fluid intake to 3 liters per day. B. Obtain prescribed IV opioid and administer for severe pain. C. Assess for bladder distension and notify the healthcare provider of possible obstruction. D. Apply heat to the flank area for comfort. Correct answer, C. Rationale. C. Inability to void with a known stone suggests possible obstruction which threatens kidney function and requires provider notification. A. Fluids are important but may worsen pain if outflow is blocked. B. Pain control is important but the risk of obstruction must be addressed first. D. Heat may help pain but is not priority over assessing for obstruction. Question 57. A 67-year-old client with newly diagnosed osteoporosis is being discharged with a prescription for a bisphosphonate medication. Which teaching point is most important for the nurse to include to reduce the risk of complications? A. Take this medication at bedtime while lying flat. B. Take this medication with a full glass of water and remain sitting or standing for at least 30 minutes. C. You can crush this pill and mix it with food if it is hard to swallow. D. Always take this medication with milk to improve absorption. Correct answer, B. Rationale. B. Bisphosphonates can cause esophagitis. Taking with water and staying upright lowers this risk. A. Lying flat increases risk of esophageal irritation. C. Crushing can destroy the protective coating and increase irritation. D. Milk can interfere with absorption of some bisphosphonates. Question 58. A 48-year-old client with acute cholecystitis reports right upper quadrant pain radiating to the right shoulder after eating a fast food meal. The provider writes an order for diet teaching. Which food choice by the client indicates correct understanding of dietary changes to reduce symptoms? A. Fried chicken and French fries. B. Baked fish, steamed vegetables, and rice. C. Cheeseburger with extra cheese. D. Pepperoni pizza and soda. Correct answer, B. Rationale. B. Low-fat meals such as baked lean protein and steamed vegetables reduce gallbladder stimulation and pain. A, C, D. These are high-fat foods that increase gallbladder contractions and worsen symptoms. Question 59. A 70-year-old client is post-operative day 2 after a total knee replacement. The client is receiving low molecular weight heparin, has compression stockings in place, and is using an incentive spirometer. Which additional nursing intervention is most important to reduce the risk of venous thromboembolism? A. Encourage ankle pumping and early ambulation as prescribed. B. Restrict fluids to prevent leg swelling. C. Maintain the client on complete bed rest to protect the new joint. D. Remove compression stockings when the client is in bed. Correct answer, A. Rationale. E. Calf muscle activation and early ambulation promote venous return and are key measures to prevent DVT after orthopedic surgery. B. Fluid restriction may increase blood viscosity and clot risk. C. Prolonged immobility increases DVT risk. D. Compression stockings should remain in place as ordered to help prevent clot formation. Question 60. A 69-year-old client with type 2 diabetes is admitted with confusion, extreme thirst, and weakness. Lab results: glucose 780 milligrams per deciliter, serum osmolality elevated, pH 7.38, no significant ketones, sodium mildly low. Vital signs: temperature 100.2, heart rate 120, respiratory rate 20, blood pressure 92/58. Which intervention is the priority for this client? A. Begin aggressive IV isotonic fluid resuscitation as prescribed. B. Start IV sodium bicarbonate to correct acidosis. C. Restrict oral and IV fluids to prevent cerebral edema. D. Give long-acting subcutaneous insulin immediately. Correct answer: A. Rationale: A. HHS is marked by severe dehydration and high osmolality. Rapid fluid replacement is the first priority to restore perfusion. B. pH is normal. Bicarbonate is not needed. C. Fluid restriction would worsen shock and dehydration. D. Long-acting insulin is not used for acute correction. IV insulin is used after fluid resuscitation begins.